We had our weekly conference call with governors across the country, states and territories, and I was able to convey to them our appreciation for the leadership that every governor of every state and territory has provided. Thanks to their leadership, thanks to the extraordinary cooperation of the American people, despite the fact that more than 770,000 Americans have contracted the coronavirus, and our hearts grieve for the more than 41,000 Americans who've lost their life. The truth is that as we stand here today, we are slowing the spread. And as the President reflected, we continue to see steady progress in less cases, lower hospitalizations, even in hotspots around the country. And we commended America's governors for their efforts in that regard. We are preserving our healthcare capacity, as the General with the Army Corps of Engineers reflected. The President's direction, we've built a great number of hospitals around the country, but the utilization rate has been fairly low because of the mitigation efforts, the cooperation of the American people. We have not had to use them. And that, as the President said, is very good news. In a word, we thank governors across the country for taking actions, decisive action, to save lives and to make a difference. I reminded them that we're all in this together. We have one mission, we're one team. We spoke on the conference call about last week's guidelines to open up America again. And we heard from governors across the country about the progress that they are making. We spoke to governors from New Jersey, Connecticut, Florida, Louisiana, Texas, and Michigan about their ongoing efforts at social distancing and addressed questions that they had about needs that have been spoken of already in this presentation today. In addition, as we promised last week when we spoke to governors on Thursday about the guidelines to open up America, our team presented every governor in the country, states and territories, with a memorandum detailing laboratory capacity and all locations of laboratory equipment for diagnostic tests that can perform the coronavirus test. We also provided, as Dr. Birx will elaborate in just a few moments, literally a map about where these testing devices are located. And I must tell you, Mr. President, I was very impressed at the way governors, as we speak, are scaling testing in their own states using these resources. Our hope is that by providing this information and by our team that we've enlisted out of Walter Reed, that's contacting every one of the laboratories in the country to find out what their needs are and to encourage them to activate those testing machines to do coronavirus testing, that will continue to be able to support a state-managed effort to increase testing even more. But a few highlights. Governor Doug Ducey announced antibody testing for 250,000 health professionals this week and first responders, a partnership between the state and the University of Arizona. We spoke today about Governor Gavin Newsom's announcement that he set up a task force for testing, 5 to 7 high-capacity testing hubs in partnership with UC San Diego and UC Davis to increase testing in high-capacity labs around the state of California. We heard from Governor Ron DeSantis, Mr. President, about the efforts of the state of Florida. I believe he said that at this time Florida had conducted 275,000 coronavirus tests, and they're in the process of a major expansion of statewide testing with the goal of opening up additional sites and using the Florida National Guard to test residents at nursing homes and long-term care facilities in Florida. We also recommended today to every governor's attention the public health website that the state of Florida established, which has useful information on a county-by-county level about where testing is happening. Mr. President, as you said, governors are utilizing testing assets. They're managing and deploying these resources as they see fit. And at your direction, we're going to continue to work very closely with them. Other governors that we spoke with included Governor Gretchen Whitmer of Michigan. There are 13 new or expanded coronavirus drive-through testing sites in Michigan that her team has stood up with Michigan Primary Care Association, and we assured her that we would continue to work as Brad and Admiral Giroir are literally working around the clock to make sure that they have the supplies to support all of that testing. As the President said, Governor Hogan, who always begins our conference calls, as he's chairman of the National Governors Association, expressed appreciation for last week's guidelines to open America up again, and his appreciation on behalf of all the governors for the list of laboratories in each individual state. He did raise the issue that we had included on the list Department of Defense facilities that have laboratories and machines, and also other federal facilities, many of which are in Maryland. And I was able to assure Governor Hogan and every governor on the call that we will make all of those laboratories available across the country to every state as the need for testing capacity continues to scale. And so this is one more step where you see the Army Corps of Engineers, where you literally see thousands of military doctors and nurses on the streets of New York and other cities around the country. This is one more step where we're literally, as the President said from early on, are leaving no stone unturned, and we are delivering a whole of government approach for our states as they deal with the coronavirus outbreak. Governors are continuing to expand testing, and we assured them that we're going to continue to work in every way to support their efforts to do just that. I will say again, as we've said before, as Dr. Birx comes up to explain to you what we delivered to the governors today, we told the governors once again today that by our best estimates, we have enough testing capacity today for every state in America to go to phase 1 if they meet the other criteria of 14 days of reduced cases and sufficient hospital capacity to prepare for any eventuality that may occur. Once again, we have enough testing capacity for every state in America to go to phase 1, but we assured the governors today that we're going to continue to work around the clock to expand the testing capacity, support supplies, and to support their efforts to encourage social distancing and the very mitigation efforts that the American people have been doing that have brought us the progress that we see all across the country today. With that, Mr. President, I'll just let Dr. Birx describe what we distributed today.
Thank you, Mike. Deborah?
Thank you, Mr. Vice President, Mr. President. We just want to show you a couple of additional slides, but also to remind all of Americans that we still have a significant number of cases, both in the Boston area and across Massachusetts and Chicago, to really that our hearts go out to those cities as they continue to struggle with coronavirus and the consequences at the hospitalization, to all the healthcare providers that are on the front lines. We wanted, so these are just an illustration of the different types of equipment that are out there, describing them both as low speed, but quick turnaround time, to high speed and taking 3 to 4 hours to actually run 100 or more tests. And so the equipment ranged from all those different, and that's why there's 5,000 of them as noted by the President in this list. We wanted every governor and every state and health laboratory director to have a clear understanding of the full capacity within the state, both for the capacity, but also where technical assistance and additional supplies may be available. And we were proud to put the federal labs on that list because the military and the VA have stepped up every step of the way to provide support both in testing and care. And we have many military members on the front lines, and I'm sure the military would offer their facilities to the governor of Maryland or any governor who wanted to utilize those to expand testing. So the next slide, I'm just going to run through them very quickly. So every governor not only received the Excel spreadsheet with the complete list of the equipment and the zip code of the location and the laboratory to really be able to create a mosaic of laboratories of the high speed and low speed equipment together to meet the needs of their clients, depending if they're drive-through or hospital needs. So this is what Florida looks like. Next slide. This is what Louisiana looks like. Next slide. Maryland with significant capacity. Next slide. Virginia with significant capacity throughout the state. Next slide. New York, obviously a lot of capacity in New York City with overlapping capacity. It's important to know where this is because then hospitals and labs can support each other when they need surge capacity. Next slide. This is New Jersey. Next slide. Pennsylvania. Next slide. Massachusetts. Next slide. Ohio. Next slide. Oklahoma. Next slide. Washington. next slide. I think that's Wyoming. So we wanted to show both in states that have large populations and in states that have lower populations. You can see that in general, the number of machines match their population. And we're working with the Walter Reed Group and the American Society of Microbiologists and all the lab directors to really create a web of understanding of what the capacity is currently, what the capacity can be, and how the federal government can support them in developing their strategies linked to the overarching federal strategy of testing as outlined in our guidelines.